Hi there, folks. Thank you so much for joining us. And joining me today is Dr. Daniel Charos to talk about when patients come to see you with difficulty breathing. I would imagine that's a common thing, right?
It's a great question. It's one of the most common things patients
But there are a lot of
come to see
reasons
us.
for that, correct?
Exactly. Patients can come in with severe sinus infections, nasal polyps, deviated septums, bad allergies,
Sure.
all that stuff.
Today, though, we're talking about something specific, and it's with the nasal valve.
The nasal valve.
Okay.
The nasal valve is the narrowest part of the airway that we have as human beings. It's right in the front of the nose, and we've got a little animation too to help show this. And so this is just kind of a cutaway of the inside of the nose. So right there, if we just pause it for a second, right where it's blue, right where that air that's representing the airflow, it's blue. You can see how narrowed and constricted it is before it becomes green and kind of fans out over the rest of the nose.
Okay.
When that nasal valve is narrow, that can be a real contributor to why people are having difficulty breathing through their nose, even contributing to lack of energy or sleep or snoring problems.
I would imagine there are a lot of reasons for that nasal valve to be obstructed, right? Mm-hmm. Okay, but to alleviate that, what do you use in your office?
So in the past, patients with nasal valve problems might have been recommended invasive surgical procedures, which may have involved even like rhinoplasty type approaches with cartilage grafting and things like that. What this is showing here is the application of radiofrequency energy to gently resculpt and remodel that nasal tissue to really improve the area, the diameter of that nasal valve region.
What is this appliance here?
This is a handheld single-use device that uses just low radiofrequency energy in order to resculpt that tissue, and that's what it is right there.
Called Vivair.
It's called Vivair.
Okay. How long does it take to perform the procedure?
And so we'll spend about 20 minutes just getting a patient numb enough to do, before we do anything.
Sure.
The procedure itself takes about 5 minutes.
Oh boy. And recovery time is immediate?
It's almost immediate. There may be a little bit of tenderness. Some people may have, crusting for a few days or a few weeks afterwards, but there's no reason they wouldn't be able to return to work almost immediately.
And outcomes?
Outcomes have been fantastic. In fact, some people are actually experiencing results while we're performing the procedure.
Oh boy, okay. And insurance covers this for the most part?
For the most part, covered by most insurances.
Dr. Charos, great stuff. We appreciate it. Thank you so much for joining us, and we'll see you next time.